practiced at Environment and Climate Change Canada for 10 years. There, he co-led a research program studying particulate matter composition and emissions from motor vehicles and developed the deployment of a heavily instrumented mobile lab to take measurements. Currently, he is involved in several different projects related to health effects of air pollution. He leads the environmental component of the National Canadian Healthy Infant Longitudinal Study, which is based at Sick Kids Hospital in McMaster University. He is the principal investigator and founder of the Canadian Urban Environmental Health Research Consortium, which he directs. He also directs a Healthy Plan City database, which produces data visualization and analysis tools for healthy urban planning. For the past 5 years, he has also been serving on the research committee of the Health Effects Institute, which is a leading international organization helping to support the mandate of the automotive industry and the US EPA. The title of his talk is Doubling Down on the Co-Benefits of Urban Adaptation. Yep.
Thanks very much for that introduction, and everybody here for being here today and for inviting me. Great conversations going on so far. I'm just biting my lip as I'm hearing everything that's talked about. And yes, I'm now here at the University of Toronto. I came from actually starting as a meteorologist in Environment Climate Change Canada, and then senior scientist, and much of it is around health. As I've come to the University of Toronto, also, with a deep-seated climate anxiety that I think many people have, I thought as I come to this next phase of my career, I want to try to work on solution-oriented research as much as I can. And so I think I'm going to talk a little bit about something that we've created that is in that vein. Again, thanks very much. I do spend quite a bit of my time working in the health area, and that's, I think, an area that has lots of opportunity to sort of to change minds, push the bar forward. It certainly has done that in the air pollution field quite a bit. Incidentally, air pollution and health really started in Canada from the question of what are the health effects of acid rain related pollution, coming back to Ian's presentation about acid rain. And that has like kick-started this whole big progress with respect to air pollution. But we all know that the Lancet is one of the leading, most prestigious health journals on Earth, in the world. And the Lancet has, over now since 2015, been putting out this series of special issues around climate change and tackling climate change. They've been certainly in this space for a while longer, but in 2015, as they sort of started their first official issue on this topic, the key point they were saying at that time was that tackling climate change could be the greatest global health opportunity of the 21st century. And they're thinking not a lot about the direct health effects, which we know are there in spades, but even more like the indirect health benefits that we can achieve from trying to adapt and mitigate and bringing those ideas forward. We know, and as you think about health effects of climate change, some of these were in lists that Ian showed. This is kind of a list that has been around for a long time. I can remember being in meetings with Health Canada back in the 90s, going through this list of ways in which climate change is going to, or climate crisis, whatever you want to call it, is going to be impacting human health. And human health certainly is always one of the things that is in front of mind in terms of when we need to deal with these things, whether it's just health or mortality. It's a big driver. I would say that since that time though, what has really risen to the top and wasn't really something that was in the conversation that much in these earlier days. We were speculating more about things like vectors and food security and sort of longer, slower moving impacts, was the impact of extreme weather. I think that's something that is just much more apparent now and much more of a concern. And there's no doubt, we now see the atmosphere on steroids happening everywhere. And floods, you don't have to look anywhere far in the media to see about floods, like this weekend, floods in the Congo, floods in Kentucky. They're all over the place. But back to the Lancet special series of journals, as they sort of evolved further along, they brought in another key point in 2021, which was the unprecedented opportunity also to improve health, but reduce inequities, bringing in sort of two key co-benefits, two key sort of indirect ways that we can benefit from action and thinking about climate change. And that's where I come to, what I'm going to be talking about, which is really trying to think about solutions that touch on both of these and bring these sort of indirect benefits or co-benefits. So I call this sort of doubling down on sort of co-benefits of climate change. Now, in terms of equity, we certainly have the push to be thinking about this in Canadian policy. In the last year, there's been 2 bills that have really enshrined the concept of environmental equity within legislation. There has been the renewal of the Canadian Environmental Protection Act, and there's also been our own law on environmental justice. And there are 2 key things within respect to the bill that was the renewal or the amendments to the Environmental Protection Act were enshrining environmental justice and enshrining intergenerational equity. And as I heard sort of the discussion here today from very esteemed members of the senior college, I think about one of the reasons I came to the university from being in that stuffy old place up in North Toronto with scientists was to be around youth. And I just still think, this is something that there's untapped potential there in terms of trying to get youth to pay more attention to this issue. And where that might go, I don't know, but hopefully not to violence. So there is certainly this as a sort of driver as well, the equity. Now, I also heard it mentioned, I think also from Sarah, about cities being on the front lines. And also about the range of scales from what can I do up to the global. It is huge, but our cities get it. They are talking about this quite a bit, and about both mitigation and adaptation. And this is just one example of a climate change plan that exists. This is from York Region, but there's many. And I kind of like this figure because it helps me tell a bit of a story again around this health connections of the indirect health co-benefits. So if we sort of zoom in on that a little more, we can think about, okay, mitigation brings more thinking about cleaner transportation, sustainable transportation, cleaner energy. And the obvious co-benefit that brings is cleaner air, which means less mortality and morbidity. But there's also the other side of it, which is if we do get into more use of mass transit, there's more physical activity happening. People have to walk to get to the bus stop or walk wherever they're going. So that's also a good health co-benefit. If we think about dealing with food and our sources of food and trying to bring it back local, and I understand there's going to be there is a talk on that after me. That's really thinking about a healthier diet, more food security, and you can think then from there about how that leads to less obesity, less diabetes, more nutrition, all health beneficial things of just thinking about our food security and what we produce where and what we eat. But also there's other ways in which that brings within our communities and creating these sort of complete communities, which is sort of a buzz phrase that's talked about a lot, making complete streets, complete communities where you can get all of the things you need within a 15-minute walk or bike ride. That again can promote this active mobility, which again is more physical activity, better health. Complete communities also bring people together like here, which is, this other thing is social cohesion and the benefits that brings across all sorts of areas of health. And we all probably heard about the loneliness epidemic and loneliness being the new smoking. Social cohesion is critical. And I think across generations, it'd be even better. In terms of, dealing with emergencies and floods, well, we prepare for that, and we're going to certainly reduce the acute effects of acute weather events, less injury, less death if we're prepared. But there's also the chronic effects that we often think about through extreme weather, and that could lead to long-term mental health challenges as people are dealing with disasters that they've experienced. Recently, there was a great article in Nature Climate Change that finally did the analysis on the effects of hurricanes in the United States, and not like what happens right afterwards when our eyes are all cast on what's happening, but over a longer term and seeing that the actual long tail of health effects of mortality that are people dealing with these hurricanes for years and years afterwards is a much larger health impact than these short ones that get all our attention, because our attention is on to the next disaster already, of course. So less economic hardship in the short term and stress, but this is a very long-term health effect. Cooler cities, through more greening and nature-based solutions, which is a common buzzword now, certainly can reduce, hopefully without just going all towards air conditioning, less heat within cities, cool things down more. That's a health benefit. And greener cities also bring people out again into nature, to seeing nature. That's got a clear mental health benefit. The ecosystem health of healthier, greener areas is also really important, and clearly water management and air quality benefit also. So there's so many indirect benefits that can happen. There's also a lot of intersections. The causes and the solutions are really interrelated. There are sort of 4 circles I think about that bring things together into this sort of quadruple intersection, which really in my mind defines a sustainable city. And so as we're talking about adaptation, we're talking about moving towards sustainable cities, sustainable planets. Now, the solution-oriented work that we've done is we've taken this national database that sort of brought me here to U of T to develop this and make it available for health research around Canada, and it's accelerated a lot of that. But we wanted to do more with this, and so we've created healthyplan.city, which is a way to make this data available for people to think about a range of environmental equity issues in cities and think about ways they might be able to make changes in urban planning. I'm going to really focus on the climate parts of it, but there are many other aspects to healthyplan.city. And stay tuned, I've got a citizen science project for you all later on. So now, Healthy Plan really is pretty simple. It's layering sociodemographic information over geospatial and environmental data, looking at the intersections and looking at, in that bottom right there, the intersections of more equity-deserving populations and where there are larger quantities of them based on census in certain parts of cities, and then where does that intersect with more environmental-related risks. And those are areas we would call an equity priority region. Here's an example of an area that I was focusing on back in December. It was end of semester, and there was a community event out in a region that is certainly lower in the SES category within Toronto there, Keele and Weston Road area at the community center, where many of us came together to talk about climate change and adaptation. And this map is showing sort of local heat islands across this part of Toronto. And probably no surprise for climatologists or many of you that the valleys and the parks and the water are cooler, but there definitely are areas you can see from space that are the hotter pockets within cities. And in this case, you can see here on the bottom, we're not showing any vulnerable populations yet. But you really can make this sing if we zoom in now to that area where I was, there, western region of the city, and all the red is indicating more heat, but intersect that with, say, a group like lower income individuals who have less means, maybe less air conditioning. It's hard to know the penetration of air conditioning everywhere. But now the intersection starts to highlight in these darker brown polygons of census blocks where we might want to start first if we're thinking about action. Now, we know the action has to happen everywhere, all at once, whatever that movie was. But, if we need a starting point, these are maps that might give us that starting point. Where can we double down on health benefits and equity benefits at the same time as we deal with adaptation and potentially mitigation? This is now where I'm overlaying the same people, but looking at flood susceptibility. We got lots of help from the great work that is done at University of Waterloo in the climate adaptation space to identify sort of the best flood data. It's a very difficult, very controversial data set to get as to where are the flood risks for a variety of reasons. But this is what we would see in this area in terms of where might there be greater risk of floods happening that might need some more quick action to minimize the impacts. Back to heat again, we can sort of layer on top of that low income, but also low income seniors, because we know in terms of heat vulnerability, it's really lower income seniors with comorbidities that are living alone where there is the greatest concern. In this case, I'm just looking at lower income seniors and where they are in this part of the city. And this helps direct our attention. You can see where that spot was at, where these are like 3% of the people within that census area are in a higher area of average summer temperature. But these are maps. I tell people I could be making these maps sitting on Mars. It doesn't matter, it's just data, it's just maps. They need to move towards action because they're not really the solution by themselves, but they can motivate progress by highlighting opportunities where we can act first, where we can target these measures for public health benefits and inequity reduction that happens. And one of the big strengths of what we do here, because there's always better data, there will always be improving data, but at this stage, what's a big advantage of what we've done here is it's common data across all municipalities we have in here, all across Canada, for any city that's over 30,000 people. We generate that for people to work with. I ask you, like, how do you see Healthy Planet City can help you or help people that are working in different areas? We think about, yes, the Federation of Canadian Municipalities, who are helping fund our promotion of this going forward, but also how do we support local advocacy groups in action and questions they have. And there are a number of partners we've worked with, like Green Communities Canada, McMaster University, the City of Hamilton, and yes, the FCM in terms of funding and promoting this further to leverage this data in planning and decision making. With this data in the pipeline, hopefully we can start to accelerate some improvements and change. Now, if we think about what is the next step, because this is the tough leap from a map and a color on a part of the city to, like, what do you actually do about it? And I continue to struggle with that, and that's where I think really it is about partnerships and getting local. So maybe we're thinking national or global, but things happen local. And this is an example here back to that area. What one of the spots looked at, with this amazing thing, Google Earth, and you can kind of get an idea of what's there, and maybe think about how you move forward on solutions and have conversations with people at that local level. Another example for the flooding area, and where there was a high, dark brown polygon for flooding, and this is sort of a step to think about what can happen there. But the hard work is just beginning. But the data are there now that people did not have before to work in these directions and advocate, whether it's their own community group or to, whether it's planners advising decision makers at the municipal level. So I want to finish just sort of talking about sort of the hypothesis back to having this tool and thinking about inequity and thinking about what a sustainable city is. And I would certainly postulate that you can't be sustainable if you've got this long-lasting, continuing inequity in environmental exposures across cities. And so there must be ways we can generate some way to sort of report this besides maps. So we've been working on taking our tool to the next level to a climate health equity resilience index. And in this case, we've been looking at some vulnerable groups like low-income children, newly arrived immigrants, visible minorities, and then intersecting them with sort of 4 of the variables we think are related to climate, heat, and flood, and then tree canopy, which can mitigate heat, and large natural spaces, which can help manage floods. So there's 2 positives and 2 negatives that we map together, and we're starting to now get what we think is a report card that we want to start to share more widely in the coming months as we really refine this to be able to look at different cities. Like over here on the far area, we can see things that are above this one are more equitable, below are less equitable, more where you might want to pay more attention or tell these cities to pick up the slack. And this is Montreal, Toronto, and Vancouver here, so that gives you an idea of where we sit. But there is, what I was hoping for, quite a bit of variability in this, and we're really heading towards this ability for people to look at whatever city they're in and generate a simple image like this that says, where do I have issues? This is flooding in London, Ontario, and large natural spaces to manage flooding shows up in London. These are very much a draft. But we're working towards this next step of these images that we think if we get them in front of the right people, we still see the opportunity and be able to start to move forward in a direction that realizes this doubling down on climate co-benefits, or going back to Ian, it's clearly a tripling down, because doing this is a big cost savings measure as well if we try to do things in advance, pay now instead of later. So time for the citizen science. I hope you can all take a note of this website, develop.healthyplan.city. We have been developing this, talking about it in different venues, in classes, but I think this is probably the first time I've had this many people here to talk about it at once, who I think are engaged. Is everybody okay to be a citizen scientist? So what I would like you to do is, tonight at 7:30, if you can, just go to this link on a laptop and play around a little bit. I want to see if you can crash it, because it's crashed before. And as we do this more and more, across more, whatever you want to call it, users, we want to make sure that we're not like crashing Facebook or something like that, right? So, because that'll hurt our business model, so to speak. So if you want to work with us, I'll tell our web guy to watch as the big spike comes at 7:30, and we'll see whether or not it's really being able to up to the test of you all trying to put a challenge there. So put it in your calendar now for tonight at 7:30, and we'll see what happens. So I just do want to also acknowledge that we have a small team that works on this from Canoe, who have been helping bring this along. Priya Patel is here in the back, so address any questions to her. She has all the answers. But I hope we have time for some discussion like we had after Ian. So thank you very much for your attention. Mike. There you go.